When you partner with Elsevier, you get the most trusted, up-to-date educational resources in the industry. Our curriculum solutions provide you and your students with everything you need: a system of course materials, technology, training, and support that works together to make your entire program a success. But don't just take our word for it. Here's what educators are saying about Elsevier's curriculum solutions.
We use HESI products from the very beginning. We use the HESI A2 scores. Our retention specialists use those in first semester to look at what the students have done as far as critical thinking and reasoning. We also then use HESI products all the way through. We use the case studies, we use practice tests, we use SimChart, we use SLS, and then the ebooks.
HESI has case studies as well that I integrate into my classroom setting. I go through the case study and actually lecture from it. So if I'm talking about a patient in my women's and children's department that's had a postpartum bleed, I go all the way from just the postpartum hemorrhage all the way out to shock, needing fluids, even the patient coding. So that way, at the end of the day, we're able to pull all of those elements together so that the students can understand. When they go into those case studies, there are questions and with little small case studies above the questions. Those are awesome. Those are the type of questions that they are getting on boards. And there's no need of using a product that's not going to help them prepare for boards.
SimChart's a great product in that the Sim Lab is a place where they can make all the mistakes that they're scared of making in the real clinical environment, and they learn so well from that.
We've been very pleased with the Elsevier products that we've used with our students. Students in their final semester have the opportunity to use simulations from Elsevier for Lewis, our med-surg textbook, and they use the electronic medical record within that.
It has given them a safe environment to be able to do skills in that before they'd have to do it with patients, and also allow them to be able to problem solve together to how to best handle the situation. As they move through the program, those scenarios will increase in terms of number of patients they have to care for.
So having the electronic medical record available allows us to have a more objective view of each student's ability to chart, so that we're sure that we can compare them on a level basis.
So I talk to them a lot about creating a study environment. Then I talk about how PageBurst helps them study. That studying can't be passive, that it has to be active. And one of the ways they can make their study active is using all the highlight features in PageBurst and creating a study guide from all their highlights.
HESI is the exam that we're using, and that determines how they're doing within the semester. They do have to pass the HESI, of course, and we use that to kind of model what the students or how they're doing as far as when they get ready to take boards.
In fourth semester, they graduate, but I do not sign their affidavit of graduation until they have completed the entire remediation package.
We've noticed an improvement in board scores over the years that we've used HESI as an exit benchmark for our students.
What we have seen with results and board scores is the students who scored below 850 and did the remediation, over 95% of them have passed boards on the first time.
We're very pleased with the results that we've gotten by using Elsevier products, and we intend to maintain our relationship with Elsevier.
By partnering with Elsevier, you'll reach more students and achieve your program goals. And you'll have your own success story to tell.